have a mosquito like Stevenson. The vaccine is not for the mosquito. What causes malaria is the parasite. The parasite is transmitted by the mosquito when it bites any man that has the parasite. So if you are giving a vaccine to the child, what you are doing, one, is to prevent the child from having the malaria or the severe form of the disease. With respect to the mosquito, which is the main vector that transmits the parasite, what we do, one, is prevention. Prevention in the sense that you need to reduce the vectorial capacity. And that can be done if we all ensure that we keep our environment clean. Two, we use the interventions that have been made available to us. If you have the insecticide-treated mosquito nets, you use them. Our parasite prevalence have reduced once again. We are now at 8.6. In 2011, the whole country were around almost 28%. So we have really made progress. But if you have a vector like this, that has the high chance of increasing the mosquito population. What it means is that it has the ability to more or less worsen the malaria situation and retrogress the progress we have made. So indeed, we are cautious of that, and that is why we have all these measures in place, engaging people to understand the need to push towards elimination. And for all of us coming on board, it means that we really have to use the various interventions available and then ensure that we keep our environment clean.
And that is the mosquito you see in your short, Anopheles stephensi, and it's deadlier. It can survive in areas where traditionally the Anopheles would not survive, and we have been exposed in Tuba and Dansuman areas. There is some conglomeration, if you like, of these mosquitoes. But we have an issue on our hands. It's a health situation, because if they proliferate, you know, our health system, we're going to be in a crisis. Well, joining us for a conversation on this all-important matter, we have Florence Kuchi, Director of Public Affairs at the AMA. Madam Kuchi, a very good morning to you.
Good morning, sir.
It's good to have you join the conversation this morning. Now, this is a new invasive species, and we know that traditionally the Anopheles has certain characteristics. This one seems to have broader characteristics. Then again, we know that this Anopheles stephensi and what it does was first detected in Africa, on the continent, in 2019. It is back. What can you tell us about this strain of mosquito and what it means now that it is here with us?
Yes, thank you very much. Let me take this opportunity to say very good morning to your cherished listeners and viewers. We all know that malaria are carriers of mosquitoes are carriers of malaria. They don't, when they bite a person who has the malaria this thing in the person, then
so the parasites.
Mosquito, yes, the mosquito will then take it and then transmit it to another person. And where does these mosquitoes live? Mosquitoes live around our vicinities when we leave our communities dirty, when we leave water in areas that are not supposed to be, when we leave, used tire, worn-out tires that carry water. That is where these mosquitoes lay their eggs. So it is the duty of everybody within the vicinities, wherever you are, to ensure that you don't live in a bushy community. You make sure that you weed your community, because mosquitoes they give birth in where there are bushes. Also, where there are areas containers that collect water in it, mosquitoes also lay their eggs there and breed in it. So we need to ensure that we clean our communities. We weed our our houses, we ensure that we don't leave containers that will collect water that will help in breeding of mosquitoes. Also, we need to put dirty oil in areas that we have gates to do something that it has water has been collected inside. And
Right.
when you put the dirty oil in it, due to the how it will cover it, there will not be air for the mosquitoes to live in. So they will definitely die. So when we are able to keep our community clean, we are really doing away with the breeding and then the spread of these mosquitoes. Yes, because for some time now, Ghana is trying as much as possible to be safe from malaria spreading mosquitoes. For instance, the Anopheles mosquitoes. And there has been spraying of larvicidis in all the assemblies within the Accra enclave.
Right.
But-
So do you feel that with where we are, for example, the Director General of the Ghana Health Service, Dr. Patrick Kumabwaje, makes mention of the fact that to sustain the gains made in the fight against malaria, a national task force has been set up to advise on strategies of minimizing the impact of this new strain or this new mosquito on the population. Do you feel we're doing enough already? Because there's the malaria control program. But in this instance, with this new development, there's a lot more that we have to be doing, right? What more can we expect from the Public Health Directorate and the AMA?
Malaria control is a holistic effort. It is all-inclusive effort. It is not one entity that is supposed to ensure that we control malaria in the country. It is everybody's business. For instance, as I spoke about the weedy nature of our environment, people live in their houses. They don't see the need to even weed. People live in their houses. They leave containers everywhere. When it rains, they collect water. People live in their houses. They have open spaces that collect water all over. So when we all come together, come on board and ensure that we clean our vicinities, we weed our weedy areas, we don't allow water to be collected at areas that are not supposed to be. When you have a container that is there and you think it can collect water and you don't need it, you just separate some holes inside. For instance, our walnut ties, we leave them, they collect water. You can just separate some holes inside. As we are doing that, we are all coming together. As the medical aspect is taking place, the preventive aspect is also taking place. And then at the end of it all, we all come cumulatively and we all try to do away with the mosquitoes that are going to cause this malaria in us. So in AMA, as you said, the education is still ongoing. We are ensuring that people abide by living in the clean community because mosquitoes are creatures that like living in dirty areas. If your community is clean, you wouldn't see mosquitoes there. You only see mosquitoes as swampy areas where there are dirty waters and all that. So these are things we all need to come together. It is a collective effort that we need to put together to ensure that we help ourselves.
Now, we do know that malaria kills over 600,000 people, a lot of them children right here in Africa. So it's quite an issue that we have to deal with, looking at the characteristics of this mosquito and the strain of malaria that it actually propagates. But I'd like to find out, I do not know whether you have any details on this. Recently, Ghana became the first country to approve the use of that new malaria vaccine described by scientists as a world changer from Oxford. I do not know whether this came right before this new strain of mosquito and its parasites, but it would be interesting to find out whether this vaccine has any impact on the malaria parasites that Anopheles stephensi actually injects or infects a human with. I do not know whether you have any information on that.
Yes, malaria vaccine is a good thing that has come, and Ghana has embraced it. Why? Because children below 5 years are dying a lot through malaria. And when they are vaccinated against the malaria, it means that some antibodies have been introduced into their system. So when the malaria causing mosquito bites, they are able to fight against the parasite that will lead to the causing of the malaria. So Ghana is trying as much as possible to calm down malaria-causing agents. So that is why it has become a very serious issue when these parasites were identified at Tuba and Dansuma and its environment. So a lot of effort is being put around that area to ensure that we try with the people living around the area. We all come together collectively, holistically to help as much as possible so that the efforts that have been put in place by the government, ensuring that these malaria vaccines have come in and we have started using it, it does not just become effortless.
We also know that here in Africa, according to statistics generated by the World Health Organization, this could put as many as 126 million more Africans at risk of getting malaria because of how this new vector proliferates and all of that. But I'd like to find out, to conclude the conversation, the Director General of the Ghana Health Service has charged regional and district health directors to implement a number of measures, including the removal of water collection points in and around homes and communities to minimize breeding sites, among others. What would be your charge to individuals, ordinary Ghanaians? What should we be doing in our communities? What are some of the steps we should follow to prevent attracting these dangerous mosquitoes?
Yes, so as ordinary Ghanaians, we still go back to the same thing. We ensure that wherever we live, we should not leave our environment to be so swampy, to be so weedy. We shouldn't leave our areas that there are open trenches that will collect water. So when you have a place that you've seen that there is an area that it has rained, water has collected, and then you feel it can lead to breeding of mosquitoes, you just try and get some dirty oil and pour it on top of kerosene. When you pour it on top of the water, it will cover the top, so there will not be any oxygen beneath it. So if there are other mosquito larvae inside, they are all going to die. We should also ensure that we don't leave containers that will also collect water when it rains. We should try to empty every water that has been collected during rain. Our worn-out tires, we should try to put some preparation on them so that they don't collect water. When we are able to do all these things, we ensure that we don't throw our rubbish indiscriminately. Everybody to ensure that you manage your vicinity very neat to ensure that there wouldn't be a place serving as a suitable environment for these mosquitoes that to have the chance to breathe in. So I think if we all do these things together, including the education that the public health officers are giving out there, we are going to try and help to fight this as a country.
And we also know, just to cap off the conversation, that it can breed even in extremely high temperatures, which you wouldn't usually expect of the mosquitoes. So during the rainy season, they are pretty active. But this, strain of mosquito can breed even in, survive and breed in extremely high temperatures during the dry season as well. So it's not just about the rainy season and what will happen. The dry season as well. We must keep all of these in mind in the course of the period. Florence, we're grateful for your time this morning. Thank you so much for joining us.
Thank you so much, sir. Thank you.
And Florence Kuchi is a Director of Public Health with the AMA. She joined us for that conversation. We know what to do. Let's apply it and stay safe. Look at the casualty rate across the world, 600,000 every year, a lot of them children in Africa. And according to the World Health Organization, about 126 million Africans are going to be exposed on the back of this new mosquito breed. Not new technically, but its return to Africa, Anopheles stephensi. Well, that's how we cap off the conversation. But up next, we have more for you on the AM show. Bernice Abubakar Lanza will be taking over from here.